Have you ever wondered if a simple exercise, something you can do in just 3 minutes a day, could actually improve your erections, your stamina, even your bladder control? It sounds almost too easy, but this isn't a gimmick or a viral trick. It's physiology the same way you can strengthen your heart or your core. You can train the muscles that control your erection. I'm Dr. Carolina, a urologist. I work with men every day who want to feel strong, confident, and capable again, but they've been told that the only answers are pills or surgery. What I want you to know is that your body already has the tools. You just have to learn how to use them. And yes, it really does take only a few minutes a day as men get older. Especially past 50 or 60, erections often become less firm, and bladder control can slip a little. That doesn't mean you're broken. It means your circulation nerves and pelvic floor muscles aren't communicating as efficiently as they used to. The most common culprits are the same ones that affect your heart, high blood pressure, diabetes, stress, even some medications. All of them reduce blood flow and nerve sensitivity in the pelvic region. The good news is that blood vessels and muscles respond beautifully to targeted exercise, and that's exactly what we're about to talk about. The pelvic floor is a sling of muscles that supports your bladder, bowel, and sexual organs. It's the foundation of male vitality. When you contract those muscles, they press gently on the veins that drain blood from the penis, trapping that blood inside and keeping the erection firm when those muscles are weak. Blood escapes too soon and hardness fades. When they're strong, they act like a natural pump, increasing blood flow, nerve sensitivity, and control. So this isn't about magically increasing your size. It's about optimizing what nature gave you and keeping it performing at its best. Now let me show you what a proper 3-minute pelvic floor routine looks like. It's simple, safe, and you can do it anywhere at your desk, in your car, even while watching TV. Start with the slow hold. Gently tighten the muscles you'd use to stop yourself from urinating. Don't squeeze your abs or buttocks. Focus deep inside a lifting sensation rather than a push. Hold that contraction for 3 to 5 seconds, then relax completely for another 3 to 5. Breathe normally the whole time. No straining, no holding your breath. Repeat 10 to 12 times. This builds endurance and control, the foundation of steady erections and bladder support. Next, move to the quick flicks. Tighten and release rapidly. 1 second on, 1 second off for about a minute. These quick pulses train reflex speed, the same coordination your body uses during arousal. Finally, finish with the endurance hold. Tighten those same muscles and hold them for 10 to 15 seconds. Breathing slowly, then relax completely before the next round. This longer hold builds stamina and staying power. That's it. 3 minutes, 1 minute for each phase. The first week, you'll simply be learning control. By week 2 or 3, you'll feel more connection to those deep muscles. By week 4, most men notice stronger morning erections, better bladder control, and greater confidence. Now let's talk about what's actually happening inside. When you contract these muscles, you increase pressure within the pelvic veins and force fresh oxygen-rich blood into the erectile tissue. Over time, that improves vascular tone and elasticity. The improved circulation also helps nerve endings fire more efficiently, which means heightened sensitivity and quicker arousal. It's not a trick, it's rehabilitation. We use the exact same principles in clinical settings to help men recover from prostate surgery or treat premature ejaculation. You are simply doing a lighter preventive version, but remember, consistency matters more than intensity. Overdoing it can cause fatigue or tightness, which actually worsens performance. 3 focus minutes are plenty. Quality beats quantity. Let's clear up a few common mistakes. I see. Don't bear down like you're pushing. That increases abdominal pressure instead of lifting the pelvic floor. Don't hold your breath. Oxygen is your ally here. Don't tense your thighs or buttocks. Isolate the deep muscles only and don't chase quick results with long sessions. Like any training, progress comes from repetition over time. Here's what you can expect when you get it right. Within weeks, you'll likely notice firmer, longer-lasting erections, stronger climax control, and reduced dribbling after urination. Many men also report fewer nighttime trips to the bathroom and improved confidence and intimacy. And because these same muscles stabilize your pelvis, your posture and core strength improve too. Now, a quick but important medical note: Kegel-style exercises are powerful, but they're not a cure-all. If you are experiencing persistent erectile problems, pelvic pain, or urinary symptoms that don't improve, it's essential to see a doctor. Those issues can signal heart disease, diabetes, hormonal imbalance, or prostate conditions that need medical evaluation. Think of these exercises as part of your maintenance plan, not your only treatment. For the best results, combine this 3-minute practice with habits that support vascular health. Eat a balanced diet, rich in vegetables, berries, whole grains, and healthy fats. Do regular cardio, exercise, walking, cycling, swimming, anything that keeps your heart strong. Sleep at least 7 hours, manage stress. These things raise nitric oxide, lower blood pressure, and improve the very blood flow your pelvic muscles are trying to harness. So here's your simple daily plan. 3 minutes of targeted pelvic floor training, a brisk walk, real food on your plate, plenty of water, and consistent sleep. Do that for 30 days and you'll feel the difference not just in your erections, but in your overall energy and mood. If you're over 60, this routine becomes even more valuable. At that age, the pelvic floor muscles naturally thin if they're not used. The good news is that they respond quickly when you start working them. I've seen men in their 70s regain impressive control and firmness simply by doing these exercises faithfully. It's never too late to train. Let's pause for a second and address expectations. This routine won't make you grow inches overnight. It's not about chasing impossible promises. It's about maximizing your natural performance. What changes is your function, the quality of your blood flow, your ability to sustain pressure, and the reliability of your response. That's what real confidence is built on. So when you finish this video, don't overthink it. Start small. Do 1 round of each step right now. No one will even know you're doing it. Set a reminder on your phone for the same time tomorrow. Make it a quiet ritual, a moment of care for your own body. Because here's the truth. This is not vanity. Recall health is a window into overall vascular health. The same arteries that feed the penis feed the heart and brain. If your erections are weakening, it's often an early warning sign that your circulation needs attention. When you strengthen this system, you're protecting far more than your sex life. You're protecting your longevity, so take this seriously, but don't be afraid of it. You're not broken. You're simply untrained, train, and you'll adapt. That's how the human body works. And if you remember just one thing from this video, let it be this: 3 minutes a day can change how you feel about yourself, not because of magic, but because you took control of something that matters. If this helped you, give it a like so it reaches more men who need real answers instead of false hope. Subscribe for straightforward science-based advice about men's health and vitality, and share this with someone who might be struggling quiet. You could give them a place to start. I'm Dr. Carolina. Your health, your confidence, your performance, they're all connected and they're all trainable. So start today, take 3 minutes. You'll be amazed at what your body can do when you simply give it the chance.